Hello, a very good morning to one and all. So today my topic is equipment and monitoring in pediatric anesthesia. It's a very important topic because when you enter a theater, how you get prepared for a case makes a lot of difference, and particularly when you encounter emergencies, having all the equipment ready makes a big difference in the outcome. So whenever you think about pediatric anesthesia, particularly if you work in a setup where you do a mix of both adult and pediatric patients, it's very important that you prepare for a pediatric patient based on the age, weight, and other comorbidities. So the first thing we enter in the morning, we have a child to have anesthesia for, let's say, for herniatomy. Make sure that you know the weight of the child, height of the child, and then accordingly you tend to keep all the equipment ready. So always try and have a smaller version of the adult equipment. So this includes the full gamut of things which we are likely to use in the perioperative period. So let's start off with the airway, which is the most frequent thing which we start off with. So you have a face mask, and how would you size the face mask for a child? So the top of the face mask should cover the bridge of the nose, and the lower part of the face mask should cover the mentum or the mental groove. However, you have different shapes of face mask. You have what is called the RBS. RBS is something which is frequently asked in the exam. It is called Rendell-Baker-Soucek face mask. Why it was popular initially was because it's got a low dead space. Now, very frequently we use what is called the triangular face mask, the middle one, which comes in disposable versions. And then you have the circular face mask. Again, the fit might be different. So the face mask, you need to make sure that they fit to the patient's facial configuration. And in emergency situations, you can use an adult face mask. And you can do that by inverting the face mask, where the apex of the triangle is at the mental groove. Now, in this picture, you can see that this is a neonate having a face mask. The mask on the right is clearly a unfit because it is covering the eyes as well. So the one on the left is the better one. You have the bridge of the nose having the face mask, the top end, and the bottom sitting at the mentum.